Good morning, everyone, and welcome. I am Dawn Argula. I'm the CEO of the Livermore Valley Chamber of Commerce, and I'm really happy to have all of you join us this morning for our seventh webinar with the Alameda County Public Health Officer, Dr. Nicholas Moss, on this day of April 23rd, 2021, 14 months since the beginning of the shelter in place and the COVID-19 pandemic has affected the entire world. So joining me today are my partners from the neighboring chambers of commerce, and that is Steve Van Dorn with the Pleasanton Chamber of Commerce and Inga Houston from the Dublin Chamber of Commerce. So I'll give them a moment on screen here to welcome you all.
Do you want me to go first? Can you?
Sure.
Hi, good morning. This is Inga Houston, Dublin Chamber of Commerce. Thank you, everybody, for joining us today. And we look forward to hearing from Dr. Moss and what he has to say. And thank you, Dawn, for putting this together, and Jody for making us all look good.
Oh, Steve, you're muted.
It had to happen once. Good morning, everybody. Steve Van Dorn, President and CEO of the Pleasanton Chamber of Commerce. Pleased to be with you. We look forward to having a robust discussion, and good to have you back, Dr. Moss. Thank you, Don, for putting this together, and Jody for working your magic in the background.
Thank you. And speaking of magic, our technical magic. So in case we experience some technical issues during the webinar, please be patient. We will return to you as quickly as possible. The platform that we're in, Dr. Moss leaves plenty of time in the webinar to respond to your questions, so please enter those in the chat, and we will read those to him after his presentation. And also, I do want to recognize and express thanks to Amos Productions for producing these webinars. Thank you, Jody Amos. So with that, we'll get rolling. Dr. Moss, a lot's happened since we last had you here about 6 weeks ago. We have since moved into the orange tier, and hopefully we are poised to move into the yellow tier. And the vaccine rollout has really accelerated. So we're looking forward to hearing from you on all of that, as well as what we can expect, or maybe just a little preview of the opening of the economy that was announced by our governor, which is slated for June 15th. So with that, Dr. Moss, welcome.
Thanks, Don. Good morning, everyone. Great to be back here. I've really appreciated the opportunity to regularly meet. It's part of our engagement with Tri-Valley communities, and in particular with the chambers, the business community out there. And so just glad to be back here, and glad to be back at a time where things are, relatively calm from a COVID standpoint. So we are in the orange tier, and quite stable. There's still what we call moderate community transmission of COVID, so it's still out there. We get about 80 to 100 cases reported every day to the health department. We have not really seen any upticks here around the region or around the state that look like a spring wave. A lot of the rest of the country has seen that. It's been pretty dramatic in the upper Midwest, parts of the Northeast. Other states are trending upward still, but some of the worst affected states have leveled off. I think Michigan has really seen almost like a winter surge. Although most of the rest of the states that appear to be leveling off, they didn't quite get to what happened in winter. I've been looking closely at hospitalizations. Doesn't seem like the older adults have been hospitalized in the same numbers so far in some of those places, which is hopefully a sign that the vaccine is doing its job and keeping people from getting severe disease. So I think certainly concerning what we've seen around the country. Just has not affected us locally, and or really even California. California, I think, second lowest rates in the country right now after Hawaii, and and plenty of testing is going on. It's down a little bit, but I think we would be detecting a spring wave if it was happening. So, it could still happen, but maybe between the combination of how hard we were hit over the winter surge, particularly Southern California, and despite some early hiccups, a very strong vaccine campaign in California, maybe we will not see much of a spring wave at all, or a small one. And so, I'm keeping an eye on that. But honestly, the numbers continue to look very favorable. Around the world, plenty of COVID out there. India has been in the news this week. A big surge there. Europe was some countries in Europe were dealing with a spring wave. Some of those maybe have leveled off. Interestingly, the United Kingdom, which was also very early with its vaccine campaign, has avoided a spring wave. So, I think that also speaks to the impact vaccine can have. And so we'll see. We'll see what plays out. I'm a little cautious about moving to the yellow tier, just because we have really stabilized. We're seeing a very similar picture week in, week out, going back really to early March, maybe even late February, and so, it may be hard for us, given how much is already opened up, how much travel is going on, and how much COVID is circulating in other places. It may be hard for us to get much lower faster. Maybe vaccine will help with that, but I think what's interesting about whether we move to the yellow tier is, as Don alluded to, in 2 months, the state is planning to lift the blueprint restrictions completely. And so, maybe we'll get to the yellow tier before that. Maybe we'll have a mild spring wave that'll keep us from getting to yellow, but maybe we won't, maybe we'll be able to stay in orange. But if the vaccine supply is adequate, and what they've said at the state level is eligible people being able to essentially get vaccine if they want it, not having to wait for an appointment. And if there are not a lot of severe impacts of COVID, like hospitalizations, that they will in fact lift the blueprint in June. That doesn't mean we're going back to 2019. Cal OSHA standards will remain in place. I do expect some modifications to the current Cal OSHA regulations based on where they sort of account for vaccination and vaccination of workers. But I think there are going to be pretty stringent COVID safety regulations still in place for businesses. There are some specific industries that are, regulated by the state. Healthcare is a big one, where there's like specific COVID requirements tied to licensure. So, that stuff's going to remain in place. I think for in other ways, the COVID, we're going to move to more of a guidance, recommendations, a set of guidances that are applicable across a broad range of settings. Physical distancing, keeping the numbers down, but it's not going to be the legal framework that we currently have. We could still do that at the local level. I don't foresee us doing that unless things took a very drastic turn that the state just was not responding to. Even that, it would probably have to be regional to make any sense. So I really think we're going to continue to follow the state's lead and pivot to more risk reduction guidance in the summer. And I said we're not going back to 2019. I have to be honest, I don't think COVID is going away. We're going to be living with it for some time. We don't have an approved vaccine for kids yet. We'll probably get a vaccine for 12 to 15-year-old kids starting maybe in May, certainly by the summer. I think the data is out there. I think the vaccines work. And so that's going to happen. But younger children, we may not have anything till late in the year or next year. There are going to be communities where vaccine uptake is slow. and both in Alameda County and beyond our borders. And COVID, I honestly believe at this point that if you haven't had it and you're not vaccinated, you are eventually going to get it. Nobody's going to dodge it. Nobody's going to avoid it completely. And even those people who are previously infected, immunity may wane. They may get reinfected. Could be as frequently as every year. And so I think we need to adapt to a reality where COVID is with us for the time being, hopefully not causing as much severe disease. But human beings are still adapting to this virus, and it's still adapting to us, and that's going to probably play out over years. I'm beginning to think so. So that means that doesn't mean all the restrictions are in place, and it even means probably what we're doing after the blueprint goes away. That's not going to be with us forever, but it does mean in the medium term, I think more face coverings are still going to be part of this. It's going to be tricky with face coverings, especially as more people are vaccinated, but I think that's probably going to be the last thing to go. And we may even bring them back in winter with the flu season and maybe a increased risk of COVID next winter, especially if vaccination rates are not as high as we like them. So, I think people really need to be both looking forward to a time that the restrictions are much less, but that COVID is going to be with us in some way for some time. Vaccination progress here has been excellent. We are almost 2/3 of our adult population, people 16 and older, for whom we have a vaccine. Almost 2/3 have got at least some vaccine on board. Almost 40% fully vaccinated, meaning that they got their second dose if it was a 2-dose vaccine or the 1 dose of the Johnson & Johnson. That means since almost 2/3 have got at least some vaccine, and everybody gets their second dose within 3 or 4 weeks. That means 3 or 4 weeks from now, 2/3 of adults in Alameda County are going to be fully vaccinated. You need another couple weeks after you get that second dose for maximum efficacy, but nevertheless, I mean, we are talking about very high numbers. We've heard that demand has plateaued in some places when they get into the 60% range. Overseas, UK, Israel, some of our neighboring counties have observed maybe some lessening of demand when they got to very high vaccination rates. I don't know where that happens in Alameda County. We're going to keep trying to get people vaccinated, but it just may move a little bit more slowly. As I've said, I think COVID's not going away, so vaccine is going to be real important. The Johnson & Johnson so let me back up. Supply of vaccine has continued to be a limiting factor locally. We have been hearing about supply increases late April. Now that timeline is looking more like mid-May. We do get around 70,000 doses of vaccine in Alameda County every week, not just to the health department, but to all of our healthcare providers, the Kaisers and Sutters of the world. About half of those are second doses. So plenty of vaccine coming in, but not enough to meet demand yet. Hopefully by mid-May, that'll flip over and there'll be more vaccine than we know what to do with. The Johnson & Johnson pause you may have heard about. There were some blood clots that may be vaccine related with Johnson & Johnson. And so the FDA and CDC paused the use of that vaccine about 10 days ago. We followed, just about everybody in the US followed suit while they could gather more data, make sure that medical providers knew what to look for and how to treat it. It's a very unusual combination that was observed in just, at that time, just 6 cases. I think they have a handful more at this point. It's a very rare side effect. And part of the pause was just making sure providers knew what to do because it's such an unusual clinical picture. It does appear that if I had to guess, they're going to unpause it later today, actually, maybe with a warning about, these blood clots, maybe not. And we'll be back to being able to use it, and we'll provide some communications about what it means for community members when we get more details from the CDC vaccine committee, ACIP it's called. And that'll unlock some additional supply, and of course, that's going to be really important. The risks of COVID far outweigh what we've seen so far with this Johnson and Johnson thing. The other vaccines have gone to literally hundreds of millions of people. We're not seeing really any concerning safety signals at this time. So. Let's see, I covered the blueprint going away. I covered our current status. I covered vaccine progress, Johnson & Johnson. I think maybe those are the big buckets, and we can take a deeper dive with questions. I'm sure there's a lot of questions out there.
Unmute. Right. Thank you, Dr. Moss. So I think questions are coming in. They're kind of trickling in, actually, and we have some that we have been sent ahead. But I think each of us have questions as well. So I'm going to go ahead with mine. On the vaccine supply, what was that number again, Dr. Moss, that comes into Alameda County wide for everybody?
So when I last looked, it looked like we were getting about, I think it's about 70,000 doses a week going to all vaccinating providers in the county. The county itself, we get much less than that right now. Our supply has been very constrained, although we've been able to unlock a little bit of federal vaccine supply. But overall, if you count all the providers, it's about 70,000 doses. And again, a lot of those are second doses. So that doesn't mean 70,000 people.
Right, correct. I do know we've had a few clinics here in Livermore. So we really appreciate the partnership that it's been coordinated through our school district and our LARPD partners. And when they are confirmed, they send us the info, we post it, and in less than probably 12 hours, those slots are filled. So the demand is still there, and actually bringing the vaccine to where the people are, I think, is an effective way to get that done. Because I know they're saying it's tapering off. Everybody's vaccinated who wants to be vaccinated. I don't know if I agree with that.
We're not seeing that in Alameda County. I've heard it in other places. We're not seeing that here yet. And I also just wanted to acknowledge the hard work of the school district, Superintendent Bowers, and advocating to get as much vaccine out there as possible. And I think after some initial resistance, getting the Cal OES mobile vaccine resources out to Livermore. So that was great.
Mm-hmm. Okay. Inga, Steve, do you have questions of your own for Dr. Moss?
Do you want me to take the first one?
If you want to, or if you have your own question. I know I have burning questions, so go right ahead.
Okay. This question is from Adam Fetty. I hope I said that right. Will the 6 feet of distance still be required within restaurants in June?
Yeah, great question. So I think the requirements, the legal requirements that are in place right now with the state guidance, I think those are not going to be requirements anymore after the state lifts the blueprint. So that includes the 6 feet thing. Now, there will be guidance about ventilation, limiting capacity. And I think, members of the public are going to probably be at different levels of comfort based on whether they've had vaccine yet, and just, adapting to sort of life with COVID in terms of what they're going to be comfortable with. But as a requirement, I think right now that's probably going to go away. That's my understanding of what it means when the state lifts the blueprint.
Hello, Dr. Moss again. Thanks for being here. Question that is in my mind is, let's assume we get to June 15th and the state moves forward with what the governor said. Excuse me. I know the county has the opportunity to not follow that or be more conservative. based on what you're seeing and your feelings, I know it's hard to tell what you're going to do in the future, but are you thinking you'd follow the state guidelines, or would you be more conservative, or how would you make that decision, I guess, at that time?
Yeah, great question. So this is, the things that would make me consider doing something different from the state are really whether we're seeing severe COVID, whether we're seeing people hospitalized or with severe disease locally, burden on our healthcare system, rising cases in our unvaccinated population to the point that it's really, putting people in the hospital. I think short of that, I would be, I'd be hesitant to move. Now that people are going to get COVID, and some of them are going to get, maybe some of these long-term impacts of COVID that, that are not trivial, that we're beginning to learn more about. But if we're not seeing big impacts, lots of people in the hospital, I think this is a signal. We're moving to a time where, there's a vaccine is available. People can protect themselves, particularly from the clinical, disease. And for those that choose not to get vaccinated, I think it's, it's going to be harder to implement these kinds of legal restrictions in order to, try to prevent COVID getting into folks. And as we've seen, I think the restrictions have done their job here locally. We have, we've done very well relative to some other places, but they're not perfect. They have not prevented all COVID. So, I don't want to say it would never happen, but I'm inclined to things would have to be quite bad. And then also, I really think it's hard if we are acting alone in Alameda County and Contra Costa is not doing the same thing. Santa Clara tends to be more conservative, but if they're not doing the same thing, so it would probably also have to be some regional consensus around doing something different from the state. If we were, so that's where I'd leave it for now. I can't say it's impossible. COVID's thrown a lot of curveballs at us. There's the variants, but I really, I'm hopeful that won't even come up, that we won't even have to be having those conversations. But please get vaccinated, and please tell your friends to get vaccinated. That'll really help.
Okay, restaurants are confused about the number of people per table as compared to 3 households sitting together. How do they control for that?
So I haven't read the guidance recently, and rather than kind of give wrong information here, I think I've mentioned this before, and maybe it can be if there's a chat function, we can put it in chat. But you can always email questions about these guys, even if it's state guidance. You can email questions to COVID recovery, all one word, COVID recovery at acgov.org. COVID recovery at acgov.org. And they can help you understand the guidance and how to apply it to your setting. And we can even ask questions of the state if we need to. That can be a slow process, but that's the best way if the guidance is confusing. When in doubt, I would go with the number of people, and the capacity limits, and not worry as much about the household thing, because that's, I know, very hard for restaurants to verify anyways.
Inga?
Okay, so the follow-up question is for the restaurants or event centers is by lifting the blueprint in June, will dancing be allowed?
Lifting the blueprint means everything is allowed. It means you're returning to your regular operations, except for, again, any Cal/OSHA worker safety restrictions, and if there's some specific industry state regulatory stuff for your industry. I think that's what it means. Now there's going to be a lot of guidance out there. It's going to be, keep the numbers down, keep masks on. I think masks actually will still be mandated for the time being at that point. But it means the restrictions are gone. It means that the required restrictions are gone for the most part.
Good. Next
it's more
question,
individual responsibility.
Yeah, sorry. Dr. Moss, next question. This is from Tom. He's with the Altamont Cruisers, and they sponsor a classic car show the last Sunday in September. Typical attendance of visitors is 8,000 to 10,000. What are your thoughts about something like this happening in September?
Yeah. So the state has made some noise about regulating very large mass gathering events. They often talk like the big music festivals and things like that. And so a car show with 8,000 to 10,000 people may be subject to those types of regulations. My guess is that you'll be able to do it. I'm not sure what those regulations are going to look like, but there is going to be some, and I haven't seen anything in writing yet. So I don't want to, I can't give too many details, but I know the state is probably going to have some specifics around very large, mass events, and so we'll see what that looks like. Probably, and I would expect face covering is going to be part of that.
Okay. And how many people can be hosted outdoors for a wedding ceremony or celebration of life? And I don't know if they mean today or after June 15th or maybe both.
Yeah. So after June 15th, it's going to be all recommendations, keep the numbers reasonable, those kinds of things. I believe. The state could come out with something else. The numbers currently, I'll try to look up on the call and get them to you. I think I just don't have it off the top of my head. It's outdoor wedding was the question, right?
Hosted outdoors for wedding, ceremony, or a celebration of life.
I think the ceremony is sort of treated like. I think the ceremony, if it's outdoors, I don't think we have a cap. I think we have a recommendation to try to keep the numbers under, I want to say 200. But I think that there's no hard cap on the number for the ceremony. But the reception is a different question. So let me I can pull that up.
Inga?
I think he's looking something up.
Oh, I was going to say we can go on to the next question.
Okay. We have a comment outside downtown event. I'm not sure if that went with the question before, so I'm going to move to the next one. Does it seem like we will need boosters or an annual vaccination?
Good question. Okay, so we don't know yet. But I think prudently, some scientists who work on vaccines, the companies involved, are working on boosters, expecting that there probably will be at least within a year got vaccinated. Maybe it's a mild cold and it's not going to be such a big deal. But we just don't know yet. So prudently, people are preparing. I don't think it'll be I think it'll be maybe annual, at least for the time being, or longer. I don't think people are going to have to get a booster in the fall, for example. But we're still learning, and the virus does adapt. And one of the things that we're pivoting to now in public health is trying to viral variants that cause severe disease in vaccinated people. If they cause asymptomatic disease, that doesn't matter so much. But if it's a viral variant that puts people in the hospital, even though they've had a vaccine, that might cause the booster discussion to change. We haven't really seen much of that, if any, so far.
Dr. Moss, I
And
just want to go. Oh, I'm sorry. Go ahead.
Yeah, let me just wrap up. So the private event guidance, are you ready? In the orange tier, this is until June 15th. If we're in the orange tier, maximum of 100 people, and you can go up to 300 if all guests are tested or show proof of full vaccination. And the state has some guidelines about what that means. So 100 if you don't do the testing and the vaccination stuff, and 300 if you can certify that for everyone. And the state has published guidance on this, and this applies to weddings, but meetings, conferences, other types of outdoor receptions. Sorry, Steve.
No problem. Thank you. That's great. My question reverts back to what you said about what after June 15th, and assuming the state provides additional guidelines. Are we expecting more guidelines that will be coming just so we can help our business community prepare for that? Or is it going to be wide open?
I think
what I'm getting.
Yeah, well, I think it's going to be, so again, I'm quite confident that it's not going to be legally mandated restrictions. Guidance, guidelines, optional stuff that businesses can follow to keep their customers and workforce safe, over and above, again, the Cal OSHA thing. I think there's going to be a lot of that, but the legal restrictions that are currently in place, I think those are, for the most part, going to go away. Again, maybe with some exceptions around these like mass, very large events like outdoor music festivals and things like that. I do think then what the guidance looks like after June 15th, I'm hoping to learn more from the state in a few weeks. Everybody's asking for this because it's been a bit vague. I think it's going to be fairly generic. It's not going to be like, restaurants do this and bowling alleys do that and movie theaters do this. I think it's going to be more like, in all settings, these are the things you can do to, reduce the risk of COVID. And a lot of it's going to be on, maximizing ventilation and, keeping capacity, not being at full capacity, things like that. But it's going to be optional. People are going to be able to sort of legally run their business, I think, the way they see fit within the law.
Awesome. That's awesome news. And our businesses will do so responsibly. So we just need to
I think it's as people did before.
Yeah, come in.
Yeah, as people did before COVID and have done during COVID. It's just that it'll be much more flexible, I think.
Okay, good. We're looking forward to that. So hopefully it will be very easy to understand and uncomplicated, so that everyone can execute properly.
If it's coming from the state, I can't promise that it'll be uncomplicated, but maybe. I sympathize.
Looking for. Okay, we have a comment here. This weekend is the second round of shots for the Livermore Community Vaccine Clinic. In fact, I go get my second one at 1 today. And so apparently there's word out that another 1,000 vaccines are going to be available to walk-ins tomorrow at the May Neeson Park that LARPD owns and operates. So we will get more information on that. And if that is indeed the case, we will definitely publish it so that folks can put that on their radar and register if needed ahead of time. And another question that I have here is the testing, Dr. Moss. Do those tests also identify the variant?
Good question. So right now, the regular, commercially available COVID tests, you go to your doctor, you get a test. Those tests, for the most part, do not identify any variant. There's a few little wrinkles there with certain tests that, that I won't get into. There's a little bit of nuance, but generally speaking, you don't know if it's a variant or not. The tests work as far as we know, and I think FDA has been looking at this. The approved tests in the U.S. all work, and they're kind of designed to be pretty robust in the case of some viral mutations. So the test will detect whether there's COVID there. In order to tell if you have a variant, it's a little more complicated. You have to do some additional laboratory testing, and people have been able to do that at scale. I think the Stanford lab that Valley Care uses, I think they're able to screen everything for at least certain types of variants. But it requires, in order to really know how many variants are out there, you have to probably, the best way to do it is to sort of take a subset of tests that you think is representative of the community and do some additional lab work on those and look at what kind of variants pop up. And then also to make sure you're looking at, as I said, anybody with unexpected severe disease. For example, in a vaccinated person, you can target those specimens and sequence those. And so that is happening to some extent now. And Santa Clara has a pretty good sort of surveillance system in place. We'd like to do something similar where we, get a kind of a representative subset of specimens and look for variants. It's a little bit more scattershot currently. So we have some sense of what's out there, but it can't just be with the tests, the regular tests alone. It requires some extra elbow grease.
Thank you.
Sorry. We have a question from Maria. When will we get a heads up or lead time for planning on the guidelines for OSHA and others? And when we'll be moving indoors once we more away from the tiered system in June. I hope that wasn't as choppy as it sounded to me.
I do think the state wants to, there's a lot of pressure on the state to put out sort of what life will look like after June 15th in the coming week. So I'm hopeful at least by mid-May, I hope that stuff will be out there. So you'll know, okay, this is going to go away June 15th, the blueprint for a safer economy, that goes away. And here's the new thing that kicks in on June 16th. And so I'm hopeful to get that in the next couple weeks, hopefully by mid-May at the latest. And again, you can, the state's COVID-19 website will have these updates, but also you can reach out to COVID Recovery, that email I gave before, and ask them if they have updates, or look at our website. We'll post the state, news about the state. You can follow us on Twitter or Facebook, Instagram at Dare to Be Well with the number 2. At Dare to Be Well with the number 2 in there. So those are ways that you could try to stay on top of that information. It should be in the news, I hope. And then I think, so that's about looking out for the updated guidance. I feel like there's another part of that question, Inga.
Still muted. On what the guidelines will be for moving indoors. So once we move away from the tiered system. So I think that's what they're looking at is what's indoor, because we've talked about outdoors.
Mm-hmm. So again, when the blueprint goes away, you'll generally speaking be able to resume normal operations, including indoor operations. And I expect that the state will offer general guidance around maximizing ventilation indoors, operating at, lower than 100% capacity, and ensuring face covering use, except when people are actually, eating or drinking. I think those are probably going to be part of it, and they'll apply for, across, all sectors. And I think in terms of Cal OSHA updates, which was part of the question. So again, the Cal OSHA rules are in place. The update that we're anticipating is that they're going to make some adaptations for vaccinated workers. And what I'm hopeful is that'll just mirror CDC and CDPH guidance for vaccinated people outside of the work settings. That if they're asymptomatic, they don't need to be excluded from work. And exposed workers don't need to be excluded from work if they're asymptomatic and vaccinated. There may be other Cal OSHA updates, but that's the main one I'm looking for. I don't know the timeline or what, hopefully we'll get it. You can follow those additional information sources, but yeah, maybe the chambers will be, I don't know if you share OSHA updates, but something to look at.
That's our last question in the question box. Steve, do you have anything?
Oh, yes, of course. I have lots of questions. Let me just go back to your comment you made about mandatory masks. I think you said, maybe I misheard you, but after June 15th, you still feel that will be required. As chambers and conference facilities and organizations that are really excited about doing their events again in person, we're looking at planning our mixer, for example, in July, and we'll be outside. Will masks most likely be mandated if you're not drinking or eating? What's your feeling about that?
Yeah, well, this is interesting. And if you've been following the press, it's been sort of a public discussion that's been going on. How safe is it outside? The state has so far signaled that they are planning to stick with the mask mandate. But if there were to be a change, I think it would be that masks might come off for outdoor activities or certain types of outdoor activities. I think if there's enough political pressure, it could happen sooner, but I think they're going to want to push that back. And there's a couple of reasons. One is there'll be a lot of unvaccinated people. Kids are not going to be vaccinated for a while. Although outdoors is clearly safer, there's going to be a lot more going on this summer as all these restrictions go away, and masks and vaccine are going to be our most important tools. And so I think they're going to be a little hesitant to get rid of what has been such an important tool. Masks will continue to be, I think, definitely required indoors when you're not eating for the time being, maybe through the rest of the year. I don't know for sure. Well, depends what the fall holds. And again, I point out, no vaccine for kids yet, right? So they can still get it, they can still pass it on, and masks are going to be important because kids are a big part of everybody's life. So masks indoors, I think are probably going to be with us. The problem with lifting the mask mandate for outdoor use is very quickly it'll erode this norm that we have tried so hard to build, where you look around and people wear masks. And I think my concern, and I'm sure that the state officials share this, is if you're not seeing masks outdoors, it's just that much harder for individuals and businesses to maintain that standard indoors. Nevertheless, my guess is that's probably where we'll end up, maybe in the fall, is that masks are only required indoors. And from a public health standpoint, as long as people are pretty good about indoor mask use, that's probably going to be okay. We'll see. Sorry, I can't answer these questions without lots of nuance.
That we understand, Dr. Moss. The crystal ball does get a little fuzzy sometimes. Okay, question about vaccines. There are still folks that do have questions, on their minds about the efficacy and the safety of vaccines. So we have a question here about how can the current vaccines be a one-size-fits-all? And how are we able to confirm that there will or won't be side effects in the future?
Okay, let's see. A few things. First of all, anytime I talk about vaccine safety, it's important to talk about COVID danger, right? COVID is extremely dangerous. It's extremely common. Everybody who's not vaccinated will get COVID. So plan to get it. Maybe you'll have asymptomatic or mild disease. Maybe you'll be a COVID long hauler. Maybe you'll end up in the hospital, particularly severe for older adults, but plenty of younger adults end up in the hospital. Not as many of them pass away from COVID, fortunately. So I think you have to factor that into any planning and discussion about vaccine safety, is that COVID is much riskier. The vaccines have been shown to be very safe in clinical trials, but there's this whole safety monitoring process that happens with vaccines and any pharmaceutical after they're released for use in the general public. And that's how we found out about these blood clots with the Johnson & Johnson vaccine. They happen in about 1 in a million people, so extremely rare. Sometimes it's hard to wrap your mind around what a million means, right? So I like to say this, like, Jesus died less than 1 million days ago. It has not been a million days since Jesus left the earth, okay? And so it's a huge number. 1 in a million is extremely rare. The risks of dying of COVID for anybody are much higher. But our vaccine safety system picked that signal up and said, hey, something's going on. Let's take a look. And so we have a very good safety monitoring system in place that if there are safety issues that emerge with vaccines, we'll know about them. Long-term safety issues are not usually observed with vaccines. The vast majority of vaccine side effects are observed for any vaccine, not just COVID, are observed within the first 2 months. Is it possible that something could happen down the road? Absolutely. I'm a doctor. I never rule out any rare possibilities, but based on everything we know about vaccines and about how these vaccines work, there's no reason to expect any long-term impact. Even these vaccines over the long term shouldn't look much different from your body from a natural COVID infection in terms of like, they're not still in your body. They're gone. There's no leftover vaccine. All that's left is the signal to your immune system to look out for things that look like COVID. So to the extent that, there could be some long-term effects there, we just haven't had COVID around long enough to know. But I again would point to what we know from all other vaccines is that if you don't have a side effect in the first, few months, you're very unlikely to see anything. So long-term risk, no reason to suspect anything will pop up. Couldn't 100% rule it out. COVID risk, very high. You'll get COVID if you're not vaccinated. I would plan for that.
Thank you.
I think that lightweight answers the next question for someone who had the J&J over a month ago. And should they still worry about side effects? So they got another month?
Well, the J&J, well, that's a general rule of thumb for all vaccines. The J&J was very safe in clinical trials. And we've seen this 1 in a million blood clots. We'll see if some more. I heard that they identified a handful of additional cases, not like hundreds or thousands more with the pause. So we'll see we'll find out about those numbers today, this afternoon. So far, all of those happened within 13 days. So based on what we know so far, if you're 2 weeks out, the risk is probably low. We've said 3 weeks to most people. If you're still within 3 weeks of getting the vaccine and you start having these, they are a severe headache, unusually severe headache, chest or abdominal pain or difficulty breathing or unusual leg pain, to talk to your doctor. And if you're having a medical emergency, of course, go to the nearest emergency room or call 911. That's always true. But the concern for J&J so far from this clot thing, it appears to be just in the first couple weeks after after the shot. So if you're a month out, I doubt you're going to have this side effect. And it's, again, extremely rare, extremely rare. So most people are going to do just fine.
Great. To stay on the vaccine theme, we're hearing about this hesitancy to get vaccines in other parts of our country, and supplies just sitting there without patients that will get vaccinated. So it's kind of a two-part question. Can you speak about that? And I think you already have been very succinct about how important it is to get a vaccine. And secondarily, are you seeing any of that in California or in Alameda County, for that example?
Let's see. So we know that from survey data, there's some people who are like, I will never get the vaccine. That's it. Like, count me out. And, how big that number is in the end, I don't know, but it'll be some percentage of the population just says, nope, not me. Hopefully it's a small percentage. But then there's a pretty big group of people who are sort of like on the fence. They need more time. They want to see. And over time, I think a lot of those folks are going to end up getting vaccinated. Not all of them. And so I think that, and it's easier to be on the fence when numbers are low. So like here in California, there's not much COVID around right now. And I think, there's not maybe that safety concern that you might have had in December or January. I think over time, a lot of those folks will end up getting vaccinated, especially if we see, continued impacts, for example, next winter. But it might mean that, what I think is going to happen is we're going to get a huge number of our residents vaccinated, and then we'll add kids. We'll get a huge number of kids vaccinated. And then there's going to be a really long tail where people who didn't go to the Oakland Coliseum or the fairgrounds, eventually they want to get a vaccine. They might be able to get it at their drugstore or their doctor, but we don't have those mass vaccine sites open anymore. And I think that's going to happen over months, if not years, that'll happen. So far, demand here has been really pretty robust. We don't have a lot of vaccine left over sitting on the shelf. And so we'll see where we plateau locally. But again, when we start having vaccine for kids over the summer, the 12 to 15-year-olds over the summer, that unlocks tens of thousands of more county residents that will be wanting to get vaccinated. And so I think we have a ways to go locally. I also think we're going to have pretty high uptake in Alameda County of vaccine. I think when I look at the demographics of who lives here and what our uptake has been so far, I think we're going to end up being a more highly vaccinated population. Can't know for sure until we get there. But
okay, a lot on the vaccine. So let's see. Someone says that their friend does not want to take the vaccine because they state that they are not FDA approved. Can you talk about this?
Sure. So they're approved for emergency use. So it's not exactly accurate to say they're not approved. They're approved for emergency use. Emergency use authorization is what it's called, and that's why we're using them. We couldn't use them if they were not approved, not legally. And that is because, we have a very tight regulatory system for medications, all medications, including vaccine. And there's a lot of things that need to be done. And they're more than just finishing the clinical trial and demonstrating safety and efficacy, which was done with these vaccines. And so I expect we'll see regulatory full approval for at least for adults, probably later this year. I'm not sure exactly when, but that process just takes a while at the FDA, and so hopefully your friend will, when full approval happens, will sign up. I think it's important to note though that there is so many people have received these vaccines that we have huge amounts of real world, both efficacy, they work, and safety, they're safe, data, right? I mean, it's just hundreds of millions of people in the US alone. I think something like, 120 million people have received at least one dose of a vaccine. So huge amounts of information now available to us to speak to the safety and efficacy of these. So I think you'll see full approval from FDA soon.
Okay, I have kind of a follow-up to that one, so I'm going to go rogue. I have heard from my children are in the early 20s and starting to think about starting families, and they're worried about getting the vaccine because there's lots of talk that they're not sure if they're going to be able to get pregnant, have families, could you maybe say a few words about that?
There's no data to suggest that there's any link between these vaccines and any reproductive issues. And then the CDC just came out with some early, data based on people who've got it so far, showing that the vaccines were safe for, I believe, in pregnancy. And so, we're, obviously we're still learning. It's a new product, but there's absolutely zero information and no medical or scientific basis to suggest that there would be any reproductive health problems. We dealt with this in my family. My wife is breastfeeding when she first had the opportunity to get vaccinated, and we talked about what was out there and the risks and things like that. And we're planning to have more kids. I absolutely had zero concern, fear, medical basis to hold back on vaccination based on reproductive health issues. So, there's a lot out there. Stuff gets passed around the internet. There's some, ideas end up in scientific papers and in the mouths of people with titles like me that I don't think are well-founded in evidence. And so that stuff circulates, but look for good data sources. CDC, believe it or not, is trustworthy. Look at if you look at scientific literature, you want to see multiple papers about something, not just one article by one person. And talk to your doctor, talk to your healthcare provider. They, believe it or not, they can help answer these questions for you. But I think people will find that that's a non-issue.
Great. I think this is the last question we have right now in the chat. As we're seeing worldwide, there are some countries that are in their third lockdown. I guess France is one of those because of the COVID variants primarily. Do you think in the fall, when the flu season hits again, that we could possibly see another partial or full lockdown?
Yeah. So let's see, a couple things. I doubt. I think that the tolerance for a full lockdown among our residents, not just in Alameda County, but throughout the state and in the U.S., is going to be very limited, especially if we have high numbers of people vaccinated and we're not seeing people in the hospital or dying, or seeing those much lower numbers. So I based on what we know so far, I think it's very unlikely. We're a little bit ahead of where some of those countries that have experienced these spring waves and surges, we're a little bit ahead in terms of vaccine. Also, I think it's important for people to realize the U.S. has had more COVID than everybody else. India is in the news now because it's having a spring surge. They have 15 million total cases since COVID began, in a population that's like 3 times the size of the U.S. The U.S. has had 30 million reported cases. The U.S. has been hit extremely hard by COVID. A lot of people have had COVID. And so you have to be cautious comparing us to other countries because, honestly, despite the restrictions in the U.S., we kind of let it run wild. And now California is a little different, and Northern California is a little different. We do have a lot of susceptible people left. But I think that it's it's not clear that we will see the same trajectory that some of those other countries have seen. And I do think it's a lesson that no matter what you do, COVID keeps coming around and keeps infecting people who haven't had it. And so I think a lockdown is not going to prevent that from happening eventually. It would really only be useful to protect our hospitals and really limit the impact on our, older adults who haven't yet been vaccinated that we need to reach. But I just, at a certain point, we can't keep locking down, unless there's really substantial, measurable public health benefits that we're going to see.
Steve, I think there's a follow-up question on your question there that you may want to ask.
Sure, I'd be happy to. Yeah, just leading or following up on that is, why do you think these countries' numbers are surging like they are? What's causing that to happen?
Surges happen. They happen when restrictions get lifted and you have lots of susceptible people in your population. So when people, the same stuff, there weren't adequate restrictions in place, people crowded together, especially indoors, especially without masks. COVID spreads like wildfire. And, it's just the same rules that applied before still apply. And remember, we're probably, except for maybe Israel and the UK, which are relatively small countries, we're probably here in California right at the top in terms of the number of people vaccinated. And so, a lot of parts of the world just have not had that much vaccine. They haven't had the opportunity to vaccinate large numbers of their population. They have a lot of susceptible people. And that is a recipe for COVID to surge. Variants or no. I don't think variants may be part of that, but it's more than anything, it's just COVID that we know spreads like this when people get together. And so, I do think it's a sign that it can happen when the population, when people have never had it, even if, I think it might end up being a seasonal thing, like, COVID waves hit in the winter when people are crowding together indoors and, et cetera, the way a lot of other respiratory viruses do. But because nobody has had COVID before, it's not quite settled into that pattern yet. And these waves can hit anytime people are gathering together, particularly indoors. And so I think that's the story. The story is it'll keep hitting. And when you have lots of susceptible people gathered together, especially indoors without masks, you will get waves of it until everybody's had it or has been vaccinated.
Okay,
I know that's kind of a doom and gloom, but we have a vaccine, which is great. And we have so far mitigated the impacts of the spring wave seen in other places. We might still get it, but the more people vaccinated, the better. Herd immunity, the idea that that people who haven't had it yet won't get it because so many people around them have had it or have been vaccinated. That might be true for COVID, but I think it's a long way off. Probably not this year, maybe not ever. So I think it's going to keep circulating and doing this.
Do the vaccines change your DNA?
No. How's that for brevity?
Okay.
Finally. Quick answer.
So folks should say, how do we know that, right? How do you know
that? Because they work like there's no mechanism in the vaccine that would cause them to change our DNA, and they work like biological systems that we know really well from decades of research that don't result in changes to our DNA. So the answer is they do not change our DNA. And our DNA is not that easy to change. There are some viruses that actually can do it, and radiation and things like that. But it's sorry, my screen went blank. Can you hear me okay?
Yes, we can see you in here.
Yeah. So it's not that easy to change our DNA, except the natural way, reproduction, things like that.
Thank you.
Okay. Maria is getting her second shot tomorrow, and then she's going straight to work a 12-hour shift. Is there anything she can do ahead of time to help from feeling bad? Yeah. I think you want to feel bad because that means you have a good response, right?
That's right. Not everybody feels terrible. There's a range depending on a lot of factors, and you might be okay. In terms of what to do in advance, there isn't much. We recommend against taking like medications before you get vaccinated to prevent fever or pain, like Tylenol, Advil. We don't suggest taking those before the vaccine because there's a very small amount of data from studies in children with other vaccines that if you pre-medicate them with like Tylenol, for example, before they get a vaccine, their immune response might be a little blunted. It's a very small amount of information, but based on that, we recommend not taking those things before you get vaccinated. After the vaccine, you can take them. So I would wait, see how you feel. If you feel bad and you need to take some Tylenol to get through the shift, that's okay. We do recommend for people to plan around feeling cruddy for a day. Some people feel cruddy for longer. So if you can, that's what I did. I got it on a Friday. Of course, we work on weekends these days at the health department, but not everybody can do that. And so I would wait and see how you feel and maybe take some Tylenol, drink plenty of fluids.
Great. I think you answered this already, but just to clarify, a question came in just a few minutes ago from Susan. She says, I may have missed it. Does the county site-specific prevention program requirements cease after June 15th?
Yes. I mean, let me get back to you on that. I think that we will do away with that county. It's actually it's a state requirement. There may still be an OSHA safety plan requirement that'll remain in place. And so I don't want to give misinformation here. That you may still be required by OSHA to have some kind of COVID safety plan. And so let us get back to you on that.
Okay. And I have a question, Dr. Moss. It's more industry specific, and it has to do with the guidelines regarding self-service beverage services, like, a McDonald's, they give you your cup and you go in there. Yeah. So what's the latest on that? And whatever it is, if it's still prohibited, does that mean after June 15th, that will be permitted?
If it's prohibited after June 15th, it will no longer be prohibited. And I have to be honest, I had to check with the team on this a few weeks ago, maybe last time we were on this call, and I believe it is prohibited, and there was a reason for that, but I don't think those rules have changed. But I'll raise it up with the team again because they do change the rules from time to time, and sometimes those changes don't make it out to you all. So. And also, please feel free to email that question to covidrecovery@acgov.org. They live for answering questions like this. This is what they're here for. And I can't stay on top of everything, so it's helpful for me.
And we appreciate that. Anybody else?
We are out of questions.
Well,
Don, do you
I have
a question. Okay. So we're kind of getting into our excellent talk, as always, Dr. Moss. Thank you so much. I know these questions are kind of, future looking, and we appreciate you trying your best to answer them. But I guess we really don't know how COVID started, right? There's this discussion about that. And I hate to end on a kind of a negative tone here, but what's the likelihood of something like this coming back? I mean, are we prepared for another pandemic, which we hear is very likely to happen again?
So Sorry, I was trying to find the CDC recently released data on the COVID vaccines and pregnancy, and I wanted to share where to find that, but for another day. Viruses, epidemics arise. They've always done so. They will continue to do so. Just in my lifetime, we've had other coronavirus, very much more localized epidemics. SARS and MERS are similar viruses that arose probably from animals, spread to humans. They just didn't cause this global pandemic. But HIV actually probably arose before my lifetime, but became a recognized epidemic when I was a child, and a global pandemic that has killed tens of millions of people. Polio, the 1918 flu. These things happen, and this is they have differences. This, in some ways, looks a lot more like the 1918 flu than some of those other things. It's a respiratory virus, and the tools that you use to limit its spread are similar. But other things will arise, and our hope is that we don't see anything like this in the near future. It's been extremely disruptive and difficult. We could see something worse. There's always been a concern for a new flu that's more lethal because we don't have much pre-existing immunity to it. That's what happened in 1918. That risk hasn't gone away. And we hope, I think, in the public health world and the health policy world, we hope to, this is an opportunity to learn some lessons about what's better. COVID is not good, but fortunately, the fatality rate is relatively low, and the overall mortality rate probably 0.5% or lower, and so that that's quite low in terms of the terror. We could see something worse, and so I think this is why public health and disease surveillance and pandemic preparedness are important. Because it's hard to predict when these things will come out, but you can be certain that they will come. I honestly hope this is the worst one in my lifetime, and that we, it's coffee and donuts for health officers for the next, couple of decades. But it's really a question of, it's like the big one. It's like earthquakes. It's a question of when, not if.
So Dr. Moss, I have a question on our numbers. I go to the county dashboard almost daily, and was really excited when we got into the orange tier, and I thought we were headed pretty quickly into the yellow tier. But there's one of the indicators that we seem to be sort of plateaued at, and that's the number of positive cases per 100,000 people, 3.3. We need to be under 1, I believe. The other two indicators put us well in the yellow tier. Right? Oh, it needs to be under 2. What's going on with that? Why do you believe we're plateauing at that and can't seem to budge?
And Don, I check our dashboard every day too, so I'm glad to hear you do. And you've pointed out an error. Because it does say that we have to be less than 1 case per 100,000 with our adjusted case rate. But that's been changed because of state vaccination progress in low-income zip codes. It's now 2. We have to be under 2 with the adjusted case rate. So that case rate takes into account how much testing we do. We do a lot. If we did twice as much, we might be under 2 now. But it's going to be hard to get to that much testing. The reason the case rate is here is that those things I was talking about before. We have a lot of people. My estimate is 40% or more of our county residents are still susceptible to COVID. If you think about prior infection and vaccination, it's probably higher than that because the vaccine is very good, but there's going to be a few breakthrough infections, and some of those people aren't 2 weeks out from their second shot yet. So we have a lot of people still susceptible. There's a lot of COVID circulating in around the world. We have a lot of people traveling, bringing COVID back, passing it around. The B117, the virus variant discovered in the UK, is around in California. It's a little more transmissible than what we had seen previously. So if it gets into a household, it might get 4 people instead of 3 people. So it's because there's COVID circulating, and the only places that have been able to drive transmission down very far have very strict travel policies. So you can maybe travel there, but it's very strict around testing and quarantine after travel. In America, we like things a little bit looser than that. And that's okay, but it comes with the risk of people bringing COVID in. You have to have very strict isolation and quarantine rules. We have the rules, but the net is loose. People slip through. They don't talk to us, and we don't rely on law enforcement to enforce those rules. Generally, it's very much the honor system, and so. With that kind of system, it's very hard to control COVID unless it disappears for some other reason. And I think we will keep seeing this low level of cases as long as there are people who are susceptible in our communities.
Thank you.
We might get it down. We might get it down to the yellow level, maybe, but it's not going to go away.
So if we do hit the 2, Dr. Moss, do we have to stay at the 2 for another 3 weeks before we could go to the yellow, or will we go into the yellow?
That's right. Yeah, we unfortunately we have to meet the metrics. Actually, we only have to meet the metrics for 2 weeks in a row. The 3-week thing is we have to be in orange for 3 weeks before we can move. We've already done that. So if we meet those metrics 2 weeks in a row, we will go to yellow. And, it just has to happen by June 1st, right? Because 2 weeks after June 1st, it's not going to be relevant anymore. It could happen. It does seem like we've plateaued, and I don't see the decreases happening the way they were before. And we just, at the health department, there are cases out there. People want to live their lives, and right now living, for some people, that means some COVID risk, and it doesn't take much, unfortunately. But maybe with vaccination progress, we'll get there. Maybe it's possible.
And you mentioned the travel, which is having an effect on the numbers. And so there's a question about, I know the county doesn't govern what the airlines do, but now they're keeping the center seats open. I mean, how is that allowed to happen?
So the travel, there's 2 things there. So there's travel is a way that COVID keeps getting introduced into our communities, right? So let's say there was no COVID in Alameda County. And let's say we had a closed border and nobody was flying in or out. That's it. You're not going to have COVID. That's what they did in New Zealand, right? If you flew in, you had to quarantine for 2 weeks and get tested, and they put an ankle bracelet on you or whatever it was. We never did that here, which meant as long as COVID was circulating in Europe or Nebraska or Japan, it was going to have a chance to get in. And once it gets in, if it encounters susceptible people, it spreads pretty easy. We learned that, right? We know that's true of COVID. And so that's the thing about travel. You go somewhere where there's COVID, we might have low case rates here, but if you go to Miami and it's everywhere, you're going to get COVID. You bring it back, you give it to your roommate, and that has happened time and again. Now, that's not the only reason that we have COVID in Alameda County, but it's the reason that it's very hard to get to zero, right? Even if we did a perfect job of isolating and quarantining people, which we don't, it's very hard. And even if, and everything else was, everybody is perfect about wearing masks, you still have this risk of people, going somewhere where the rules are different, getting COVID, bringing it back. So, and so that's why there were these, recommendations to quarantine after travel, things like that, kind of make it voluntary. But it's very hard to eliminate it if you're allowing people to come and go. But also, even without that, it's hard to smash it to zero unless you have very strict lockdown, isolation, and quarantine. And so all of these things come into play. The middle seat issue on airplanes is different. That's the actual risk of getting COVID on the plane itself. And when I'm talking about travel, what I mean is going somewhere like Paris, where there's a lot of COVID right now, and getting it there and bringing it back. The risk on the airplane is there's some risk on airplanes that's been shown, particularly if there are people, around you who are sick in the rows around you. Not everybody on the plane is going to get sick because they filter that air very efficiently. Planes have good systems in place. They have good ventilation. They have HEPA filtration. And so the virus does actually get diluted and filtered out pretty quickly. But if you're close enough to somebody on the plane and it's a long enough flight, the risk does go up. And that's why the middle seat is an issue, makes travel just slightly less safe from that standpoint. I think vaccinated people are generally going to be, safer than others. I think where there's testing before travel, that also adds a layer of safety. But it's going to be, again, like we were talking about, everybody's going to have to decide what their level of risk tolerance is. And it is going to be, the more crowded the plane is, the more risky it is until COVID is gone. And as I said, I don't think it's going to disappear completely anytime soon.
Okay, I have a follow-up.
This is important I have a follow-up. We have, as I think many listeners know, we have a baby in my family. That there is no vaccine for him, and he's not yet 1 year old. And kids tend to not get severe COVID, but among kids who do get severe COVID, more of them are infants, under 1 year old. So, we are careful. We don't want to necessarily put him on an airplane if we don't have to, because he can't get vaccinated. So, I think it's a personal decision, but people are going to have to think about that stuff.
Okay, so testing before travel, and but the question is testing coming back? Is there any place in the world that you might say is doing it well that maybe we could book?
CDC has a map that shows where cases are. So two sources that I look at. CDC has a map that shows where COVID case rates are high. It's on their COVID data tracker page under global cases. There's a few different maps, but you can just look and see what the hotspots are around the world. That's a good guess. I think if travel is allowed, the UK is probably great right now and the very low rates, but maybe not France. You can look at those pages. Though WHO also has a map. You go to WHO's COVID page and see where the hotspots are. And then I haven't looked recently. CDC at all times, not just COVID, has a travel health and safety website. I highly recommend people look at that if you're traveling internationally. It is very concise. It's for travelers. What do you need to know about the health risks of where you're going? And they may have COVID data in there. It was important for Zika. People remember Zika. Speaking of, emerging pandemics, the CDC, you can look at CDC and see where Zika was. So they may, their travel website may also be a good resource. And I strongly encourage people to do that. I think you have to test flying back into the U.S., but state to state travel, it's state by state. I think Hawaii requires testing, but other states don't necessarily. And I don't think you need to test to come back into California from other U.S. states. So I think it's a great idea. You're doing your fellow travelers a favor. we are aware of people who test positive and get on airplanes because their needs are more important than your needs. So, that happens. And, there isn't really a enforcement or fine structure or any way we punish people for that. So there's some risk.
Then if that's the case, what about false positives? What's that?
Yeah, it's a good question. I mean, there's a lot of talk about false positives. We tend to think of a positive as a positive in public health land, right? If you tested positive on a PCR test, the molecular test, the sort of in the gold standard COVID test, that's a positive test, and we treat you as infectious. Now, you may have had COVID 2 months ago, and it sticks around, and so that test isn't perfect. I don't consider that a false positive. It's a limitation of the test that it doesn't tell you. If for somebody who's not sick, who's asymptomatic and never had symptoms, you don't know for sure whether they're infectious, or they might become infectious a day or two later. I mean, they might become symptomatic a day or two later, but sometimes you don't know in the moment. And so that's just a limitation of our tests. But I don't consider those false positives. And because we don't have more information to go on, we treat those people as infectious. There are these other tests, the antigen test, the rapid antigen test, that can have false positives. And so we like to see those. If somebody gets one of those and they don't have symptoms, and this is starting to be used in schools, like kids with no symptoms getting tested with an antigen test. I like to see a PCR test done as well to tell me whether that is a false positive or not. And so that's a concern. If somebody has symptoms and they have any COVID test that's positive, that person has COVID. I mean, you might think it's allergies, but from a public health standpoint, we're going to act as if you have COVID. And I think most medical providers should do the same.
Okay, so
I have one more thing to add. I have a follow-up. Oh, we're out of time. Public health, CDC, the state of California, we are going to have to rethink testing, PCR testing in vaccinated people without symptoms. That is going to honestly, that's something that we have to revisit, because when you have a vaccinated person with no symptoms, a positive test may be a false positive. Sorry.
Okay. All right. No. Thank you for that heads up. We'll follow up with you on that in 6 weeks. So hopefully you'll come back. And thank you very much. We really appreciate having access and the information that you're sharing with us and our businesses today. This will be posted on our websites, the recording. So share it with your friends. And thank you to my chamber CEOs and to Dr. Moss for being with us today. Everyone, have a safe and healthy rest of your day. Bye.